Pallor. Do your palms and skin look pale than before? What is the reason behind this? It is called as pallor and it is a sign indicating some significant diseases. What is pallor? Pallor is a paleness of skin and mucous membrane either as a result of diminished circulating red blood cells or diminished blood supply. It indicates that you have a low blood volume. Sites where anemia can be detected, that is the pallor. First, lower palpebral conjunctiva. Second, tongue. Third, soft palate. Fourth, palm and nails. Fifth, other mucosa areas like vaginal wall or rectum mucosa. Sites of pallor. As you can see in these pictures, that site of pallor, lower palpebral conjunctiva, tongue, palmar crease, palms, etc. Now let us see the causes of pallor. First, anemia due to hemorrhage, that is the hemorrhagic anemia. Second, hemolytic anemia. Third, dyshemopoietic, that is the deficiency of iron, folic acid or vitamin B12. Second, aplastic anemia. Third, chronic infections. Fourth, anemia due to pregnancy. Second, vasoconstriction. Vasoconstriction is also a cause of pallor. First, shock. Second, exposure to cold, fright, syncope, and postural hypertension. Arterial occlusion. Second, cutaneous, that is thick skin and nails. Clinical grading of pallor. Clinical grading of pallor. Pallor is called mild when there is pallor of only conjunctiva and or mucous membrane. Moderate when pallor of conjunctiva and or mucous membrane plus the pallor of skin. Pallor is called severe when there is pallor of the conjunctiva and or mucous membrane plus pallor of skin plus pallor of palmar crease. Thank you and let us know how was the video.